After we completed the training sessions, next came the research project reviews. Originally, we had proposed that we would find researchers who would present 5 projects. We were actually able to recruit research to bring 10 different projects to the studio for us to give them feedback on. Individual patients were expected to review at least 2 of these projects, and some actually reviewed more. The topics of the 10 projects that were presented included not only diabetes research, 5 of the projects were over that, but also we had 2 COVID-related projects, 1 project that was related to HIV, 1 that was looking at the operating room workflow, and 1 that was on compassion in the emergency medicine department.
To me, research is often about statistics, numbers, and the studio brings in the human factor given by real people, real diabetes patients.
We think about a project or maybe an idea. Sometimes we call that a wondering. And then we learn the step-by-step process of what's involved in doing research. And that leads us to something learned or discovered, and a learned or discovered outcome.
All these research questions that we come out with, and when they start doing all these studies, they know how to formulate those questions to make sure they get the correct answers, and also probably find out some things that they were looking for, answers to it, and also some things they were not looking for.
Particularly yesterday's research meeting with Dr. Neptology and his research study. It was very, very insightful, and there was lots of discussions, and I found myself just involved in the way that I wanted to be involved.
The researchers truly value what I had to say as far as suggestions and thought processes, as far as how they could implement and do things better. It felt good to know that potentially I may have had an impact on that, and that might change a policy position, potentially in the future that will help get out better information to people in those areas.
So it's intended to drawing upon the patient's experience to provide feedback for someone who's designing and hoping to implement a research project.
Hearing from such a diverse group of people with individual perspectives, what we have in common and what we don't, I'm sure is beneficial to the healthcare professionals and the academic researchers who are seeking to improve the treatment of diabetes. And I think that's a positive way that the studio impacts healthcare and research.
Thank you so much, Corey. We couldn't have done this capacity building project without your funding through the Eugene Washington Engagement Award. Stay tuned for more news out of the Patient Engagement Studio.